Can we have again our seat so that we can start our so let us have a seat and then start our good moment of discussions. Here in front of us, we have the different specialists and we have different experience from Rwanda. Who is Brazil? Who is Claudia? Where is Claudia? Where is Claudia? We have Rwanda, we have South Africa, we have Brazil. Claudia is coming soon. And we have, of course, NCC, and we have Open Homes for Children. This is also Rwanda and recent advance in Rwanda. So we will be having discussions and see how we can do it. As Francois told us, kinship care may be the best alternative care.
knowledge of the family. The uniqueness of the family, but have some something. So that will be my answer.
Okay, thank you very much. Maybe I have a follow-up question to Innocent, maybe before he stops. He raised a very, very important points, actually, in terms of understanding the uniqueness of a child, having a tailor-made response. These are all important points. And also monitoring the situation of children. What harm would there be, if we monitor all children in kinship care? Would there be any harm? Would there be any harm if we provide support to all children in kinship care? What harm do you see as a result of only making support to very few? After assessment, I think you are very specific in your response. Why not to everyone in the kinship care?
Maybe, thank you, right? We know each other. Too much respect to him. I think I need to be more clear about this because I mentioned the need to question, to have a question around every child in the kinship care, but they combined by questioning the situation of the child, including children with their biological parents. So this means that all children, including children living with their biological parents, need to be monitored, followed up. And who is going to do it? I think that is, if I come back on the context of Rwanda, that is where we have an idea of implementing this or making sure every child is followed up by Ramatou said about it, and Francois, it's about institutional. If you are talking about having volunteers in each village, it will be like minimizing, it will be playing that gatekeeping mechanism of making sure every child is followed up. But I said, and I'm still keen about that, instead of having a one-way package going to every every child, every family, I'm not seeing it as being efficient in terms of support. I would like to have always an intervention that is tailored to the needs. And this is following maybe an aspect of the experience. Because if we monitoring is good, but at a certain point, even the monitoring needs to be well designed. Because too much monitoring become an issue. That's why whatever we suggest need to be questioned. That would be so. All children need to be monitored. All children in care need to be followed up. But I would suggest when it comes on supporting children in kinship care to have a family-based approach, supporting not only the child who was placed in the family, but having an intervention that will cover the needs of all children within that family, and this will lead to the resilience of the whole family. Otherwise, someone coming from outside an agency, the government, the state, will come and will play the primary role of the family. So the family needs to be strengthened to become resilient and be able to take care of the children, to play all its role around the children.
Okay, thank you, Nasrat. I think you have given us additional points and clarifications. Francois, would you like to say a little bit on this?
Yes,
Yeah.
thank you. It's a very small one. Actually, Wilson has elaborated part of the things. Yeah, of course, all children need to be followed. All of them. Every child needs to be followed because normally, maybe it's a general saying, but I myself consider every child as a valuable person because it's just a person who does not decide for him or for herself. In most cases, somebody else is there to make decisions for the child. So that's why all the children really need follow-up. So that's why there is a commission for children. Otherwise, it will not be one. If children were not really seen as maybe target people, for violence, for neglect, for abuse, or any other thing. So now, coming back to children placed in kinship care. Yes, they need support. They need support as any other child, of course, depending on the specific needs they have. Because everything has to be, of course, done very carefully to avoid any discrimination. Because still, that discrimination that can be created, like saying, this is a group of children placed in kinship care. This is a group of children adopted. Then you will not be building a community. So now, to be capable of making sure we are harmonious kind of community with all children, like having the same opportunities like that, so that the most vulnerable ones are supported at least to reach a certain level, so that everyone can profit from the benefits of their country. So make sure we actually know who are the children who are most vulnerable, including, of course, those who might be there. Because it does not mean that every child present in kinship care has a problem. Some are good. So that's why in 2013, we carried out an assessment of most vulnerable children so that we could create a database. We have a database already. So it's in that frame to see what children need special support, depending, of course, on the needs that Innocent has been talking about, the tailored support, be it psychosocial, be it economic if needed, but without globalizing and saying all the children in kinship care, a group there, needs this kind of support. And again, the support should be, of course, formalized or maybe defined, so that it could not be any grant that is globally sent to a family and you don't know maybe why it's sent, but analyzing and assessing each and every need of the child to place that child in a group of most vulnerable children, we have realized that it would be really the most fair kind of thing. Another thing is this follow-up that I would like to put at the community. Normally, it's like a mechanism we are putting there now to advocate for those children, especially those ones who don't have that biological parent setting, so that they can, of course, get appropriate support that could come from the government, that could come from the civil society organization, faith-based organization, and the community itself. In most cases, we would like to target community itself, because government support, civil society organization support, it's something that is not consistent. But the community opportunities are consistent. If the community can manage, if with those friends of family, with the skills, we will regularly and progressively impacting them. With the linkage with social workers and psychologists that are professionals, then the community can really manage all those kind of issues relating to children within care and other children without biological. So that is normally what I can. Thank you.
Okay, thank you very much. I think he's speaking for the first time, so he took a little bit of time. But now, from now on, I think we have 3 or 4 more questions. So I need a very quick answers for the questions coming after this. Maybe this is a very simple follow-up questions. Do we need to register all children who are under kinship care before they are provided any support? Is it necessary? And if it is, what harm would there be in doing that? Like in some contexts, the government's expecting all these children to be registered before support is provided.
Yeah, I don't think we need to register all children that are in kinship care. And I think we are talking a little bit about the role of these communities. So they need to have attention, and I think a partnership with the health and education system that have children with them to see which kind of cases we could register and which kind of cases we don't need to register. So perhaps a kind of level of capacity building on the role of these committees to pay attention on what's violence and what's not violence, to be able to consider case by case.
In the context of South Africa, yes, every child who is in kinship care, in order for them to get support from government, they need to be registered. So, but what has happened from 2002, the Minister for Social Development at the time asked all grandparents and carers of children who are in kinship care to register for a foster care grant. So in South Africa, within the Children's Act, we do not have a kinship grant at all. So it is subsumed within the foster care grant. And when we mix foster care and kinship, you know foster care has a lot of steps to follow. There is screening, identification screening, court order, and all that. So what happened by then is we have a backlog of about 300,000 children in the system who have not been provided with support because we have very few social workers. In South Africa, it's only a social worker who can do the processing or to do the screening and also the court order takes the child to go with the caregiver. So the human resources within the country are few, and therefore we have a high backlog. So yes, it's a good thing to register every child at a kinship care for them to access support from government, but it has burdened the system, and we have a lot of backlog. Yes, so yes, it's a good thing because it has its own monitoring, and the child will be monitored and provided with support. But it's also striking a balance between what Claudia has said: child protection, very good, but at the expense of what? So the social workers end up doing administrative work because of the paperwork at the expense of child protection. And I think that is a lesson that we could all share from South Africa, what is happening. So, yeah.
Thank you. Can I say something? Very briefly. I think the ideal situation would be for children under kinship care to completely integrate into the new family setup. If that was possible, that would be the ideal. That would be the best thing. And I have a feeling that registering children under kinship care would actually emphasize, in a sense, the feeling that those children are different from, say, children in that family. So I'm wondering whether that would not be counterproductive in the long term, in that children would always feel they're not part of, that new family setup. They're being registered for what reason? You see what I mean? Thank you.
Thank you very much. I think there are a lot of important points already raised. Maybe going to next questions about the role of NGOs, UN representatives. What do you think your government is doing well, and what would you like to see them do differently in relation to kinship care? I wouldn't ask this question if it was in Ethiopia, but I know I think I can ask here. So yeah, you can answer.
I will try this one. I like your point because you were not asked this, but you think that us we can do, and we're in our country in front of our government. Okay. So no, without any joke, I think that again going back to Rwanda, I think that there have been some great strides that have been done over the past 3 to 4 years. I think everyone who is here, we have all seen that the issue of care has been actually put as a central issue in the development of Rwanda. The care reform is integrated into the economic and development strategy for the country. So I think this has been done, and there's been a great acknowledgement of the importance of care in Rwanda. And I think no, I mean, there's no one who can dispute that. In terms of kinship care also, because as we say, right from the beginning, when the government decided to look at its care system, they immediately favored kinship care. So I think kinship care has been given its place within the care arrangement. Now, it doesn't mean that everything has been done and that there's not more work to be done. What I would like to say maybe about the next steps or maybe the next frontier is because kinship care has been recognized as an important point, the government of Rwanda 2 years ago has already worked on some guidelines which are trying to formalize but not too much kinship care, recognizing the need for support for families in kinship care, but also recognizing the need to be able to follow up on the children in kinship care. Those guidelines so far are in draft, and I think that what needs to be done is that they need to be adopted and enforced. And I think this will provide and clarify the policy framework for kinship care in Rwanda. The other thing also that I think that can be maybe further emphasized is the linkages between the care program, whether we're talking about kinship, but also foster, and the social protection program. This is also one of the linkages that evidence has shown will yield great results, and I think is something also that could help further kinship care in Rwanda. And I think with that, I will answer the questions, and I will not be engaged from Rwanda.
I think I'll share in what the Department of Social Development or the government of South Africa is doing quite well is the provision of that financial support and other forms of support, although they are not covering every child in kinship care because they are only covering those who are registered with them. So that is something they are really actually doing very well. But also there is an amendment of the Children's Act to take care of or to include kinship care. Because like I said earlier, kinship care is subsumed within the foster care system, which has only burdened the system. So the amendment of the Children's Act was circulated and the NGOs commented on it, and they are working on it to include kinship care. So with that, at least now there will be something specifically for kinship care, which is less administrative work, and also to allow the child and youth care workers to do the assessment, because currently it's only social workers who are doing, and it's not enough. They can't cover every child. So when that goes through, then the system will work better, because social workforce, which includes the child and youth care workers, social auxiliary workers, can now do assessment. And we have a lot of those in South Africa. So the burden will be less on the social workers, and therefore concentrate on child protection issues.
Just 1 minute.
1 minute, just to say that in Brazil we have a national network with NGOs and governments together to implement our care reform. And this for more than 10 years. And this has been very helpful. So NGOs are vibrant too, as they say in South Africa, and we have collaborated a lot.
Okay, thank you.
And this was helping this network.
All right. Maybe we are going to the last question now. We are finishing from this panelist side. What role can kinship care play in advancing national efforts for care reform? Anything you can think in addition as a way forward? Anything that you think needs to be done, as a way forward to strengthen kinship care and to provide better care for children in general? Anyone who would like to come in on this point?
Thank you, Eric. During the presentation, I read one part. They said, actually, investment of children from institutional care into family-based care as an entry point. So I think we are, if I just consider the experience of Rwanda, by using the child care reform of placing children or placing all children from residential care into family-based care, it has increased itself the value of kinship care in a professional way. We didn't have that professional placement in the before the implementation of the child care reform, which means that it is already bringing some questions, which is very positive. And I like from the presentation seeing that there are the gaps that the government itself see that it need to so let's think about how to move forward. Kinship care is now playing the role on the gatekeeping, not only the spontaneous placement, but whenever there is a need of a child for proper parenting care when parents are either unable to provide parental care or are absent, if I can use that terminology, are not there. Now, the professionals are being involved in deciding where the child will fit first, not just the other way of sharing. And when I talk about professionals, I'm talking about the government, social workers. It is already bringing kinship care on another level, where we question the aunt who wants, the uncle wants, but from the assessment, the aunt is not going to be able to take care of the child. In the previous time, it was only decided by the family members and mostly based on the economic status. But here, it is possible even to place a child from this. I'm talking about prevention mainly, about gatekeeping. So the child can be placed with a family with relatively less economic strength, but where the assessment is showing more parenting skills, more availability, especially for babies. This is bringing another level of kinship care from the spontaneous towards a professional one. To bring it on the other level will be for the government to question. Do we know all children in kinship care? Dr. Fred said it may be good if we, at least we register. And there is that kind of, is it good or, yeah, there may be some adverse aspect. But if I consider like the health insurance, I was actually thinking about this night. It is difficult. I have the medical insurance from my company, but I will not be able to take the child who is under my care, because this is my nephew, this is my niece, this is my grandchild. I can't use the same card to bring the child to the clinic. I think that there may be, we need really to think about. I'm not suggesting anything, but we need to bring this on the agenda, continue the discussion even in the country, and to see the appropriate way to provide kinship care. Thank you.
Any point, on the last questions, what role can kinship care play in advancing national efforts for care reform? Any way forward?
He didn't want to speak because he spoke for a long time. He didn't want to be, but I think that, as he rightly said, I think some of the critical questions that we've been asking ourselves, and it's not that we have the answers right now, but shall we register, shall we not register, how to enter into the families, I think they are beyond only care reform, or they are beyond only kinship. I think it's critical questions that as practitioners for the protection of children, it's questions that we need to ask ourselves. So I think that the kinship care helps us, and I hope in Rwanda it will continue to help us, for us to go back to the drawing board, for us to think again, okay, what are we doing right now? I know all of us quite very proud of the child care reform that is being implemented here, even though it has its challenges. But I think the critical question that we've been asking today are critical not only for care, not only for kinship care, but it's very critical for how to work with children and their families.
All right, I think with this final question, now I open up the forum, I think, for audiences to ask questions and comments. But I would like to reiterate the last comment made. I think we need to be very careful in deciding what to do or not what to do. I think there is a saying, measure 10 times before you cut. Once you cut it, it's very difficult to repair. So we are talking about a very long I think a coping mechanism that have stayed for long. So whatever we do, we need to think of that it's not harming the already existing coping mechanism in our communities. So with that final comment, now I give you the floor. I think we have about 20 minutes or so to have some reflections, additional reflections or questions. I will take 6 questions at a time. If there is time available after the response is given, then I'll give you a second round. So I want to see hands first, please. Anyone who would like to have comments, please raise your hands. I see only 2, 3, 4, 5. I want to see the hands because it helps me to time, you know. That's why I'm asking you. 5 or 6, okay. Okay, so I think we finish this side and we'll come back. I saw the first hand at the back, so I will start from the back.
Is that on?
Yes.
Thank you very much indeed. I found it really interesting. I think I've got a question, but to begin with, I have a reflection. I'm from the United Kingdom, and one thing that really struck me, can you hear? Yeah. One thing that really struck me listening to you all was the great privilege that you have of coming from countries where you still have clearly very strong sense of community and a wealth of community resource which you can draw upon. You talked about neighbours. I live in London. I don't know the last time I saw a neighbour, never mind knew a neighbour. And working as I do with social workers in the United Kingdom, I think that we have in many ways lost the ability to tap into community resources. So the final point you made about measuring something 10 times before you cut it, for me was very powerful, and it struck me really listening to you all that the major question was how you retain and nurture the spontaneity, whilst on the other hand building in the protection mechanisms where these are needed. I wanted to ask you whether and how much you discuss the risk of over-professionalisation within your professional bodies. Because, you know, we have perhaps gone slightly the wrong way, I feel, in the UK. And I also wanted to know, and I'm sorry for my just ignorance, about foster care in Rwanda and the point at which the kinship care place, the non-spontaneous kinship care placement for a child, for example, who's come out of an institutional setting, the point at which that placement is or isn't a foster care placement. I wasn't clear in my mind about how those two services sat alongside one another, where the dividing line was. Thanks.
So second hand up here. 2, 3 hands, yeah, please. Mike, please.
Thank you so much. Mine is not a question, it's an additional. I want to add as a professional social worker. Okay, thank you. It's an addition on to what you said, the support provided to each family who received the child. And I want to emphasize, because I have been lucky to work with the DI project, HHC, where we place children from institution into families. So the support is depending on the family assessment done by the professional, as they say. But here we have to pay attention, because in our community, in our society, we have the copy mechanism, as you said, where a family can find that my neighbor received that support because he received or she received a child. So also I need to receive a child. But really, if you did you do that deep assessment, you found that it is a need of maybe a given support, not a willing of receiving a child. So there we have to pay attention to use that professional approach in order to be successful. Another point is on the placement, post-placement intervention, where we have to, you talked about, you raised the question, every child needs to be follow-up, to need a follow-up. And I was wondering if I can say yes, every child needs a regular follow-up because it depends on the child. Every child is unique, as Innocent said. Every family is unique. So I think every child needs a follow-up, and the post-placement is it depends. It can take a long, it can be short. It depends how the child is getting used to the two families. But now I am back, given in our context in Rwanda, with the placement of children from institution to families, I think it's become easier because we have to involve those community members, because we have to involve the local entities. And it's become easier because the local entities, the local leaders are involved at the beginning, at the beginning of the process. So I think the post-placement, the follow-up of the child is very important, but we still need to involve those community members, those community leaders, and then the placement will be successful. Thank you so much.
Thank you very much. I think we still need to think of the timing. So maybe if it is a comment, please limit it to 2-3 minutes. If it is a question, please make it very brief and precise, so that we'll have time, to reflect on it. Thank you. Maybe next person. All right.
Thank you. My name is Sifa from Rwanda Governance Board. I just wanted to bring up my comments, saying that kinship care comes at a time when we are taking a great approach of homegrown solutions, and I think this could be an opportunity for taking this approach forward. So building on the political will of our government and learning from the other homegrown solutions that we have, like some of them that I've seen succeeding, like Mihigo, like Udehe, like the Jirinha. So if within the same framework, I think this would be a room for taking it forward. But I just also want to bring the scenario where in our tradition, the people who are taking after the children, as Dr. Alfred said, it is true that in our culture, the orphan did exist. Because even when a mother died at the time of birth, the grandmother would bring the baby to the breast and will just take over. But the problem is today, all the women are going to work. In the past, women did go to work. They were just in the house. So the grandmother, the aunties, all the women had time to care for the children. But now we do not have a problem looking after the children, but we do not have the time to look after the children, because we are also struggling to take our children to the daycare so that we have time to work. So that's the problem, because the women who would, or the parents for that matter, who would be capable to look after the children appropriately do not have time to do so. Even managing their own children is a problem. And then all women in the country are mobilized to go into some kind of work, even in the rural areas. It's not only the women in the public service. So I think the assessment, as they are suggesting, needs to really, look into some critical social issues, so that when this takes up, we are looking at the capacity. And I would suggest that we invite caretakers who voluntarily accept to take the children, instead of just, taking up the children because they must do so. And lastly, I think the campaign should be well owned by the local government. In Rwanda, you can't succeed without the ownership of the local government, and also the friends of families belong to the communities. So if it can be integrated or work along with all other social programs, I think it would work better. Thank you so much.
Okay, thank you very much. I still insist to limit your comments to 2-3 minutes. This is better, but we still need to work on. Thank you very much for the comments. Any additional?
Thank you very much. My name is Trevor Piercy. I'm a trustee of Family for Every Child. And first, I'd like to say this has been a great learning experience for me on kinship care. I'm also a lawyer, and I was very interested in the excellent presentation by Francois on the fact that kinship care can have a legal status. And I had wrongly assumed that, unlike adoption and foster care, that kinship care probably did not. And I'd be interested in the legal status of kinship care in Rwanda and how important that was. Thank you.
Thank you. My name is Selina Ogutu. I come from Kenya, not far from here. The point I wanted to put across actually was elaborated by my sister there about registering kinship care. I think it is important because then if we don't register children under kinship care, then you get all these so-called well-wishers who want to use the children to get an extra buck. So the challenge for governments, we in Kenya, we also have these cash transfers to families that are taking care of children, grandmothers, child-headed families, and so on. And the problem is the capacity of the government in terms of human resources to monitor the children who are in kinship care. So it's a good thing, but governments need to make sure that they put in more human resources to do the monitoring. Otherwise, you get even those who are determining the criteria for the beneficiaries taking advantage of the situation. Thank you.
One more. Anyone who raised a hand but didn't get a chance? Did I miss anyone? Okay.
Merhaba, ben Bayram, Türkiye'den geliyorum.
Hello, my name is Bayram, and he's coming from Turkey.
Ben sadece bir yorum yapmak için konuşuyorum. Neredeyse ülkenin nüfusunun yarısının çocuk olduğu bir yerde çocuklarla çalışmak gerçekten çok önemli, çok kutsal bir iş olduğunu düşünüyorum.
I think, as far as I know, nearly half of the population in Rwanda are children, are under 18, and it is very difficult to work in an environment, in a setting like this.
Bunun için sizlere ayrıca teşekkür etmek istiyorum. Gerçekten kutsal işler yapıyorsunuz. Merak ettiğim bir şey var. Devlet bütçesinden çocuk koruma sistemlerine ne kadar bütçe ayırıyor şu anda da?
Okay, and thank you for this noble work. And I just wonder one thing: how much budget is allocated for the children care and children protection in Rwandan government. Thank you very much.
So thank you. I think some of the points raised are comments. So I don't know if you have schedule to reflect on. I think I'll give you a chance, but there are questions that you need to address. So anyone who would want to come in? There are, I think, 3 questions at least.
Actually, I really believe this is
sinibaza
the
niba ari
learning
settings yashizemo sura
because
nk'ahari
there are
akwanditse family bimeze nk'ibiri muri miruwari
and that are really important, like the risk of professionalizing.
ikibazo kinini
This is very important. And I think for every intervention, I will keep, that is among the principles of the social itself, to make sure we empower. We don't take the lead, we don't take the responsibility either of the family, either of the community. Rather, we empower. We empower the family, we empower the community. So even the existence of a profession is much on facilitating the ordinary flow, but avoid any risk due to absence of assessment. So this question for us may be like a recommendation that can be taken by everyone to ensure we keep that balance and we keep it forward to ensure we continue having that kind of control of avoiding putting down all the existing tradition values. Actually, should based on that, we should base all our intervention on this existing tradition, on this existing cultural values, but at the same time, make sure. I like the intervention of Sifa. She talked about the time even lacking for parents to care for their own children. When we talk about parenting skills, actually we are talking about quality time. Because as the society grows, I'm still on the first point, we have to consider the dynamics around the society evolution. And that's why the professionals are coming in. But there will never be, I'm not seeing a separation of the tradition. That's why when we talk about involving the community volunteers, they are not paid. There should be incentives, and incentives will be there. But I'm not seeing a big, actually we have all those human resources who are not trained but need to be trained to make sure they can substantially provide the support. So there is that kind of balance of having professionals as a social workforce to really investigate whenever there is a case. And the way, I think, for Rwanda, for example, the way the channel of identifying, supporting, and reporting could be like, I want to add in. So it's like, yeah, maybe Atonoa. It's like we have many volunteers at the community level. Ramatu is trying to. Fana? Yeah. So, yeah, children may be facing different child protection issues at mild and minor level. It happens in the community. Like neglect, but we have not yet talked about the extreme neglect. That the community volunteers can address that with the psychosocial support. They got skills, they got full training, for example. But when the case cannot be addressed at community level, this case will be referred until it reaches really professional. So that is the way of keeping the balance between the professional work. If we refer to the medical aspect, it will be much easy to understand. We have health community workers who address generally the issue of health at community level. At the same time, we have illnesses that are treated at health center, for example, but there are some that reaches the clinics and even some are treated outside. So that mechanism should be designed so that many people are addressing most challenges that are being faced by children. Those were actually the area I wanted to intervene. Maybe I come a bit on what Francois said. The assessment goes up to the community assessment. I said in my first intervention that there is that support to the family, but there is linkages to the existing community. We may talk about helping a family to get a house. Who is going to contribute? Umuganda, right? There is Umuganda. There are community work that comes in, and the intervention will be just to make sure the family does not go outside the standard of the community. Otherwise, the support will be an issue, as she said, of jealousy and other. Thank you.
Yes, I think maybe 2 minutes per panelist, 2 minutes for every panelist.
Can
we finalize?
Can I comment on what the lady from the UK said about lack of community, in the Western world generally? Well, yeah, I lived in the UK for 15 years, and I used to come across children who were naughty, naughty children, and I always got the urge to punish them. Children that did not belong to me. And then I would remember the police would be coming after me. But here it's different. Here we still have a sense of community. When we talk of treat every child like you, it actually means, any child, treat every child like you. When we talk of guardian angel, these are not blood relatives, but people who will take responsibility for the care and upbringing of children. So we can say we're still happy, we are still glad we have that sentiment of community, of neighbors, all of them contributing to the care and upbringing of our children. Thank you.
My comment is, I think much as we are talking about kinship care, yes, we are utilizing the community resources and strategies that have always worked within our context. But also, let's not forget that the society has changed, dynamics have changed, socioeconomic systems have changed, the structure of the family has changed, and we need to use what we have to enhance kinship care without also over-formalizing it, because that will now create problems within the social care and work protection.
Thank you. I'm not sure if I will comment. I will try to respond to a few questions that I think are left up, and I will let also my colleagues from Rwanda. Just maybe on the over-professionalization, I just wanted to make one point, which is that in a way, we've been a bit lucky here when we started the care reform program, because the system, the child protection system, was not in place. So in Rwanda, child care reform has been the entry point for the child protection system. So the way it has been thought was like trying to find this kind of balance between the professionalization, where we have the social workers and the psychologists of the government, but also the community-based structure. So it's not to say, I'm not sure if we reached the right balance, but the fact that maybe we started late enable us to have some examples. And those community, even those friends of the family, Ishutis in Rwanda, will be trained, and they will receive quite extensive training. But still, they will be for volunteers. And I think there's always this balance to be. So maybe on the same range also in the care reform, and I think also, and the rest will explain, there's both kinship care, placement kinship, and also foster care. So the two actually coincide. And maybe just to help my colleague Francois on the budget question, just to help, to see that actually the issue, and we've been working, all of us, including with the government, to be able to delineate the exact budget for child protection. In most countries, the issue is child protection is actually embedded into health, education, etc., and all the social services. So what we've been doing over the past year is trying to extract, and especially in Rwanda, it's even more difficult because we have central budget, district budget, etc. So hopefully, I'm not sure if Francois has the exact figure, but hopefully in the next few months, we'll be able to have the percentage of child protection as per the national budget. But for the care reform, there is a specific budget.
I think the over-professionalization was a provocative question. And then I heard after, every child needs a follow-up. And I was thinking about which kind of follow-up are you talking about? We have the first follow-up that is parents and relatives, the internal family. The second follow-up is community. So this both, yes, we need all the follow-up. And this, the third one, the external family follow-up. We have social services. We can have social protection if they need. We can have psychosocial approach if they need. And I've heard also about register. Perhaps registers is needed. But behind register, do we need psychosocial approach? So I have a question for you, for each one of you. If you knew that you were going to die now, you and your husband or your wife, and someone would ask you, which kind of placement would you like to put your children? Do you think that all your children would need psychosocial support? So which kind of things? When we think in Brazil, the only number I have is on the work with the group, 30% of the children in a community are cared by kinships. Here, I think it's much more. So this is the balance that my friend was saying, and we need to pay attention on this. Thank you.
Thank you, Mary France. I remind you there are two questions for you, actually the legal aspects of kinship and also the budget question. If you address that in 2 minutes, I'll be very grateful.
Thank you. Yeah, even less than 1 minute. So now, about the legalization of kinship care, it's not yet legalized in Rwanda. Yes, we are still using that. We are using it as a cultural value still. But of course, as there is a law regulating family and persons, the draft ministerial orders that Ramatu has talked about. So they contain some elements that try to guide whoever, a parent, a caregiver, or even some other interveners that can help how they could really assist those children in kinship. Yeah. Going to the budget, it's complicated because so much resources go there from different sources. Government, civil social organizations, districts themselves, faith-based organizations, volunteering people who help families for their needs. So now it's a bit complicated. We don't have an exact figure. But of course, as we are revising even the integrated child rights policy, we are trying to, of course, to combine the put together to consolidate to see exactly the approximate budget that goes on child protection. Thank you.
Thank you very much. I think the time given for this event is already finished, completed. I think that my timer has also given me a sign, so I don't think we have additional time to ask to get more reflections. So I think we are going to end the event here. I would like to thank all the panelists and all the audience, I think, for your reflections and for your inputs and comments. And I want also to remind you that the discussion started today. It didn't end. We need to continue discussing and reflecting the issue in our own context and in our countries or working environment so that we can improve services and care for children on ongoing basis. Thank you very much.
Thank you very much, my friends. Thank you very much, panelists. Really, we learned a lot, and we still have a question. And most of the time, we learn by questioning ourselves. And I think the discussion is not ended. we are continuing to discuss during our lunchtime, discussing ourselves, and we'll find the best ways where we can care our children. So we are coming at the end of our event, and I would like to ask again the panelists to join the public again. Thank you. And when they are joining the public again, thank them. Maybe you can join on join me to thank you. Yeah, thank you very much. So I would like now, as we are coming at the end, we are now we are going to hear the final remarks, and I would like to invite Dr. Alfred to invite the National Executive Secretary to close officially our discussions.
The Executive Secretary has given me the authority to close. And authority from women in Rwanda is very, very important. So I have to abide. And really, I don't have much to say other than to thank you all very, very much, especially visitors from abroad who came to be with us. We've enriched our discussions and our deliberations. I thank my fellow panelists for very, very, very useful contributions to the discussions. And of course, my colleagues from Rwanda, particularly members of MEETING and Imanzi, for hosting us and organizing what I think was a very good conference. Thank you very much. If the guest of honor allows me, I'll say to you, bon appetit. Thank you.
Thank you very much. The last communique, we will have lunch together. The lunch venue is the same venue where we had our coffee break. Bon appetit.
Yago hano hari umuryango nabagamo witwaga Niki iyi namubonye wari nibo bandiye segonderi iki yagiyemo bari gusoza bari kurangira basigaye bafata utubebe twabaye abantu birarangiye ko muzinze bari bugaruke ntabwo bagaruka Narangije gushyira hamwe. Ni ibisanzwe nanyura kuri YouTube aho turi kureba bitandukanye. YouTube nyine
Shise wahagaritse se
Stopping. Aguze na mashine yawe.
jya kuyindi fungura ibindi wumvira
Reka ngiye gusita.
bireka
N'abantu benshi barabirebye. Bamwe bonyine.
abastopinze
Yeah.
kwambaho ntibikigenda oya biracyari kereka nimba wacumuye uwuhe
Iwe. Wabukati
Jenny
yitwa Julia.
Biscuit.
Shall this